Welcome to my channel. In this video, we're going to discuss anxiety disorders. Specifically, we're going to look at the definition, the types, the symptoms, and the management. Let's get started. Anxiety disorders can be defined as a group of mental health conditions characterized by excessive and persistent fear, worry, or anxiety. These feelings often interfere with daily activities and can be accompanied by physical symptoms such as increased heart rate, sweating, and trembling. Anxiety becomes a disorder when it is out of proportion to the situation or occurs without an identified cause. There are several types of anxiety disorders, each with distinct characteristics. We have generalized anxiety disorder, panic disorder, social anxiety disorder, also known as social phobia. We have specific phobias, obsessive compulsive disorder, which is OCD. We also have post-traumatic stress disorder, PTSD. And we have the last one, which is the separation anxiety disorder, which is SAD. Okay, let's start by looking at the generalized anxiety disorder. So this is a chronic condition characterized by excessive uncontrollable worry about various aspects of life, such as work, health, or social interactions. The signs and symptoms include restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbances. When it comes to the management and treatment of generalized anxiety disorder, we use cognitive behavioral therapy, relaxation techniques, stress management, and medications like selective serotonin reuptake inhibitors or benzodiazepines. Let's look at another type of anxiety disorder, which is the panic disorder. The panic disorder is a disorder marked by recurrent unexpected panic attacks, sudden periods of intense fear that peak within minutes. The signs and symptoms of panic disorder includes heart palpitations, sweating, trembling, shortness of breath, feelings of impending doom, and fear of losing control. The management and treatment includes cognitive behavioral therapy, exposure therapy, breathing exercises, and medications such as selective serotonin reuptake inhibitors or anti-anxiety medications. Let's now look at social phobias or social anxiety disorder. So this is a persistent fear of social situations where one might be judged, embarrassed, or humiliated. The signs and symptoms include intense fear of social interactions, avoidance of social situations, blushing, sweating, nausea, and difficulty speaking. The management and treatment of social phobia includes cognitive behavioral therapy, exposure therapy, social skills training, and medications like the SSRI, which is the selective serotonin reuptake inhibitors or the beta blockers. Okay, let's now look at specific phobias. So specific phobias, these are intense, irrational fear of a specific object, situation, or activity that leads to avoidance behavior. The signs and symptoms include the immediate anxiety response upon exposure to phobic stimulus, avoidance of the object or situation, and physical symptoms like sweating or trembling. The management and treatment of specific phobias includes exposure therapy, cognitive behavioral therapy, and sometimes medications like anxiolytics. OCD, or obsessive compulsive disorder. This is a disorder characterized by intrusive, unwanted thoughts and repetitive behaviors or mental acts that the individual feels driven to perform. The signs and symptoms include obsessions, for example, fear of contamination, and compulsions. An example of such is excessive hand washing. There is also significant distress and interference with daily life. The management and treatment of OCD includes cognitive behavioral therapy, specifically exposure and response prevention. There is also selective serotonin reuptake inhibitors and sometimes antipsychotic medications. The other anxiety disorder is PTSD, post-traumatic stress disorder. This is a disorder that can develop after exposure to a traumatic event such as combat, natural disasters, or assault. The signs and symptoms include flashbacks, nightmares, severe anxiety, hypervigilance, and avoidance of reminders of the trauma. The management and treatment includes trauma-focused cognitive behavioral therapy, eye movement desensitization and reprocessing. There is also selective serotonin reuptake inhibitors and group therapy. The last type of anxiety disorder is separation anxiety disorder, SAD. So this is a condition where an individual experiences excessive anxiety regarding separation from home or loved ones. The signs and symptoms include distress when anticipating or experiencing separation, excessive worry about losing major attachment figures, and physical symptoms like headaches or stomach aches. The management and treatment includes cognitive behavioral therapy, family therapy, gradual separation practices, and sometimes medications like selective serotonin reuptake inhibitors. Okay, let's now look at the common signs and symptoms of anxiety disorders. Okay, so while each anxiety disorder has its own specific symptoms, common signs and symptoms across anxiety disorders include excessive worry or fear, restlessness or feeling on edge, fatigue, difficulty concentrating, irritability, muscle tension, sleep disturbances, and avoidance behavior. So let's look at the management and treatment of anxiety disorders. So as a group, all the anxiety disorders, we want to look at how we can manage and treat them. So management and treatment of anxiety disorders typically involves a combination of psychotherapy, which is a cognitive behavioral therapy and is highly effective in treating anxiety disorders. Exposure therapy and other forms of psychotherapy may also be beneficial. There is also medications, so antidepressants, particularly selective serotonin reuptake inhibitors, are commonly prescribed. Benzodiazepines or beta blockers may be used for a short-term relief. We also have lifestyle modifications. So regular physical activity, stress management techniques, a healthy diet, and sufficient sleep can help manage symptoms. We also have support groups. So joining support groups can provide a sense of community and help individuals cope with their anxiety.